Welcome to another edition of Reaching Out. I'm Gregory Floyd, President, Local 237 Teamsters. With us, very special guest, back again, Karen Ignagni, CEO of EmblemHealth. Karen serves as Chief Executive Officer of EmblemHealth's family of companies, which has provided access care for more than 80 years. Throughout her career, Karen has received countless honors and recognitions, including recently being named Health Power 100 by City and State, Labor Power Players by Politics New York, Healthcare Heroes by Snaps Media, and Women Power Player in Health IT by Becker's Hospital Review. Karen also serves on many city and state and federal advisory boards, too many to mention. Prior to joining EmblemHealth in 2015, Karen was the president and CEO of America's Health Insurance Plans. She also served as director of the AFL-CIO's Department of Employee Benefits. Karen was a staff member on the U.S. Senator Labor and Human Resources Committee and worked at the U.S. Department of Health and Human Services. Karen, welcome back to Reaching Out.
Thanks, Greg. So nice to be with you.
Thank you. Thank you once again for coming back. And we wanted to know, how is EmblemHealth moving with the industry?
It's a really good question. And let me answer it in the simplest, most straightforward way. We've begun to rethink what we do. And that is to say, for all of your listeners, think about opening your windows. We've opened our windows and realized that we could play a larger role for individuals. So we're thinking much bigger. And let me give you some examples. We've always been very well positioned to be a guide, a navigator, a supporter for people reaching out and seeking healthcare services. And that's how people think about the health plan community. But we've also understood now there's a very important mission to encourage prevention, to help people really live their best lives. And they should expect that from us. And we can talk more about that. Also, coaching. We found that so many individuals just need that little support to, are you taking your medicines? Are you filling your prescriptions? I have asthma. If I don't fill my prescriptions, I end up in the hospital emergency room. Pretty simple, but people get busy. So having someone to egg them on, to work with them on nutrition, to help them when they feel depressed, to get connected to someone to talk with. And finally, just really thinking about how hard it is for everyone today to deal with all of the things they're dealing with in their families, in the overall society in which we all live. But many, many people are struggling with food insecurity. Not only do they not know exactly what to eat, but they don't have the resources to buy food. So how do we connect them to community resources? How do we help them have stable apartments? How do we help them if landlords are increasing apartment fees? So we've set up a whole network of community-based centers called neighborhood care to help with those, you might in the old days have called them social services. Today, we think about them inextricably as healthcare services and supports. So that's how we're thinking about how we're positioned and how we provide more value to people who depend upon us, and we know that they depend upon us.
Now, tell me, someone has to be a member of EmblemHealth to access that care?
It's a great question.
Yes.
No, I'm happy to tell you, absolutely not. We have 14 centers located in some of the most underserved communities in our area. People can walk in and we do the job for you. You can take a class. You can both take a personal class. We have a whole range of community individuals who have been longtime Zumba participants, and whether they're members of ours or not. You can take a chair yoga class online, in our neighborhood care centers. You can get help with food insecurity. You can get help with social services. You can find a doctor. You can get a questioned answer about your healthcare coverage. And particularly for people who are perhaps between jobs, between coverage, we can help you make recommendations and connect you to the New York State healthcare marketplace for further assistance as well.
Wow, this is a great resource that
Yeah.
is underutilized and it's underreported and it's unknown. So
And you know
let's
what's interesting about that?
yes.
About now, about almost 40% of individuals who use neighborhood care are city workers because they need help with all of these issues too. They need help with burnout. They need help with nutrition. They need help with diabetes, in addition to individuals who live and work in their local communities.
Wow. Well, let's take advantage of this program to let New Yorkers know what's available to them.
Yeah,
So you say they're located in you have 14
14
locations.
in all the boroughs, and individuals can Google neighborhood care. That we have a team of people who actually live in the neighborhoods that they serve. They understand the neighborhoods. They look like the people who live in the neighborhoods. So we have been very focused on culturally appropriate care, helping with people deal with healthcare equities. That's a very large issue, quite appropriately for the mayor and his team and for our governor. And we've partnered with the city and the state on issues around health equities that the health department in the city and the state are also very focused on, and quite appropriately so, really addressing inequities in healthcare.
Now, tell us some of the companies that fall under the EmblemHealth
Mhm.
umbrella.
We have EmblemHealth, which is our broad umbrella for our family of companies. We have Advantage Care, which is our medical operation, also 40 centers throughout the boroughs, 5 boroughs in Long Island, have been embedded in our communities for about 60, 70 years, depending upon the centers. They've all been renovated. And in the older days, we used to offer primarily primary care through those centers. Now we have first class, in addition to first class primary care, the highest level of primary care designation and awards by the state. We also have first class specialty care. So we have GI services, we have ophthalmology, we have women's health, we have cardiac services. So those are just a few podiatric services. You can get your care soup to nuts, from primary care to specialty services. And a number of our neighborhood healthcare centers are embedded in our Advantage Care physician practices. So people truly can get end-to-end support, which is very, very important because everyone is busy. They want to have things under one roof. We have Quest as a partner in most of our centers. We have RadNet, Lenox Hill Radiology, a partner in most of our centers. So again, people can get 3D mammogram with artificial intelligence, which is the best of what's out there now to get cancer detected early. That's just one example. We offer nuclear cardiology. We offer GI services, and with a team of leaders, physician leaders, and technology experts that are giving first-class care, award-winning first-class care. I talked about neighborhood care also under our umbrella. And the last area I'll talk about, and happy to go on further, Greg, about this part of our enterprise, but WellSpark is a national wellness company that partnered with us early on in our city HMO, our HMO Gold program for union leaders, members, and city workers. And what they brought to that program is an innovative approach to delivering care focused on coaching and support services. And so we were one of the first out with those services. It is the most comprehensive, and it should be for city workers who keep the city working and rolling for all of us. And we're very excited to see the results of that in the support systems we've offered. But WellSpark is now operating in 30 states, partnering with different employer groups, educational organizations, and individuals themselves to take this notion of wellness on the road, if you will, across the country. And that's growing very, very fast.
Very good. Will there be changes to clients' health plans in 2023?
We are offering a number of new things. We stepped back and said, our members, the communities we serve, and we're in the tri-state area, that's our focus, need more chronic care help, both chronic care detection, chronic care management, and chronic care support. So we've focused not only our healthcare services, but our support services on doing that job. We've also embarked on, I hope people have seen it and enjoy it on buses, on subway entrances, etc., an advertising campaign reminding people to get their prevention, to get their mammograms, to get their screenings, to get their immunizations, because we need to make sure we are doing our part to make people feel safe and supported. And that's part of it, that whole issue of prevention.
You're listening to Reaching Out. I'm Gregory Floyd, President, Local 237 Teamsters. With me and with us is a very special guest, Karen Ignagni, who is the CEO of EmblemHealth. And we're talking about healthcare. There are always a lot of exciting things going on at EmblemHealth. Is there anything New York would like to know? Tell us about that.
I think that New Yorkers want and should expect to know that with our plan, they're well treated, they are well supported, and we are on the front lines of innovation. And one of the issues, I think, to your question, I'd like to talk about, which has been much in the news these days, artificial intelligence. And when you talk about artificial intelligence, everyone feels like, I'm not sure what to make of that. Let me give you an example how we are using artificial intelligence. It's to see patterns early so we can work with our physician partners, our hospital partners to intervene early before things become a catastrophe for individuals. So we can tell if individuals are going to the emergency room more than an average number of visits. And the goal is to prevent people from having to go to the emergency room, getting the primary care they need with a family physician, internist, nurse practitioner, etc., and getting the chronic care they need. But if they do find themselves in an emergency room, why are they there? Do they have linkages to the specialists they need? Are they going for heart palpitations? How do we get them connected to a cardiologist that can take care of them? Are they going because they're dizzy? How do we connect them with primary care physicians and specialty physicians that can support what they need and be accessible so that they are not forced to wait until 2 o'clock in the morning when you have nowhere else to go and you're frightened, not to mention tired. You're frightened about, well, what do I do? And so we've been spending a lot of time building the technology to help us better support our members, whether they are city workers, whether they are working for a small business, a large business, whether they're Medicare members, Medicaid members, or essential members. We serve all populations, and we're very proud of that. And we've customized our support systems to make sure we are doing the best for the people we serve. And that's our mission. And that should be our mission.
What does the future hold for EmblemHealth plans in coordinating patient care?
One of the biggest things we see that we have moved to, and I hope, Greg, some of your listeners have heard something about this and maybe even experienced it. We realize that the communities that we serve have many needs. We talked earlier about health equities. We talked about social determinants of care. We talked about food insecurity. So we've started doing health expos in all of the boroughs, partnering with hospitals, partnering with physician groups, partnering with community-based organizations and city organizations so that we can marshal the troops, if you will, to go into a community to give screenings, to make people aware of services that heretofore maybe they didn't realize they needed, or maybe they didn't know where to get them, but also to allow families, make it a family day, to have some fun. We've partnered with local barbershops. We have great music. We have entertainment for kids. So it can be a family affair. And healthcare is not only an individual issue, but it is a family affair. And we want to make sure we're doing the job at the kitchen table for individuals as they're thinking about their healthcare options, but also in the community and letting them have a little fun in the process. I also want to thank the um, the police department, the fire department, sanitation. They have come out for us at these events and made people feel safe. The fire department is teaching people how to detect whether someone is having a heart attack, how to do what is necessary in that situation so they know what to do. And we're very grateful for all of that and for all of the city workers that have helped make these expos possible.
Wow, that's something. And when do these events usually take place?
We've done them in warmer weather. We don't expect people to come to health fairs in the cold. So we start late spring through the summer. We were in the Bronx this summer. It was over 100 degrees. So maybe that day wasn't the best day in retrospect,
Yeah.
but we were in Brooklyn and Queens in the fall, and it was glorious days. So they were, the man upstairs was looking out for us.
Wow. How would our listeners find out about your health fairs?
We post them on our websites, and we partner with our wonderful borough presidents to get the word out in all of our local communities and with our city council leaders as well. So we're very focused on partnerships. Our role is to support and to make sure that everybody feels that these events can be theirs and can be proud of that and really feel great about the mission of healthier futures for people that live in the areas that we serve, but also our beneficiaries. But we serve a number of people at these local health fairs that are not part of our membership.
Okay. So, as we know, mental health has been in the news, and many of our members are dealing with challenges ranging from anxiety and depression and burnout. Can you elaborate more on what we can do with mental health?
Yeah, I think this is, some days I feel the whole country is burned out after COVID, to tell you the truth. And certainly in New York City, where we're having this conversation, we were so hard hit. And it's not behind us. People are still getting COVID. And I just want to remind folks, when you're in crowded areas, wear your mask. It takes no time to put it on, but you'll protect yourself also, not only from COVID, but from the flu. I think that this, having experienced what we did in New York City with COVID, we learned a couple of things. We learned how easily it was for people who lived in one of the largest, most vibrant cities in the world to be isolated. And that wears on you because people were inside so long. So again, we started a Peace of Mind initiative to reach out to our members, to check on them. And tragically, that many individuals told us we were the first contact they had with anyone outside their family, and in some cases anyone, in a month or 4 weeks or 5 weeks, etc. So that wears on you. So that gave us a sense that burnout, isolation, stress, depression is something that they're at levels we hadn't seen before. So we went to work to customize programs and we're running some of these newer programs on our HMO Gold program for city workers now, also for our other programs that we are delivering to different populations so that people can opt into a program on burnout, listen to a trained coach, social worker, psychologists, we have nurses, we have various individuals who have been well trained and now certified to talk people through issues, to get them talking. We keep classes small. They're virtual so people can access them easily. And what we found is just by virtue of knowing there was a place to go, we always post resources for people to not only participate in the program, but to read how they can actually learn more about these issues, whatever the issue is that's troubling them. And we try to then get a feedback loop so we know what additional programs to run. So you're going to see us, Greg, do much more in this area of mental health support. We think of it like wellness. And we have to deal, and the mayor has a great initiative that is ongoing now that I've had the honor of participating in, and it's run by the deputy mayor. It's a very important initiative to destigmatize mental health, to give people a sense that it is okay to raise your hand, that there are resources around, and this program will do a great job, I know, of making people aware of the resources that are available through the city. Our job is to make our beneficiaries always aware continuously of what we can do for them so that they don't find themselves in crisis. But this is a societal crisis right now of mental health, of burnout, of isolation. And it's very, very important for all sectors of our city to work together to address these issues, but give people permission to talk about it, to say they need help, and just to be tuned in to all of those issues is so important.
How would someone access the city services? Someone's in need of the service. You say the mayor has the initiative. How would they contact someone so they could receive these services?
Well, the city health department does a terrific job, and the city will be hearing more, I know, about this broader initiative, which is so important here and now. On our website, they can access services, they can access classes, they can find out where they can go in person to neighborhood care centers, where we can help support them and connect them with local physicians, psychologists, social workers, et cetera, to do the job that people need, which is to allow folks to be supported in the way that right now, here and now, they need that support.
Thank you. Karen, thank you for all of your information, all of your services, all that you do. You've been a wealth of information. And for our listeners, you're listening to Reaching Out, Karen Ignagni, CEO of EmblemHealth. And Karen is going to tell you the website once again so you could look and access some of the information that we spoke about.
It's very simple, EmblemHealth.com.
EmblemHealth.com.
Yep.
Thank you. Thank you once again for coming on Reaching Out.
Thank you, Greg. Thanks for inviting me.
Thanks.